Hi students, today we are going to see the right atrium. When the right atrium essay is asked, you have to write about the structures opening into the right atrium. Okay, so superior vena cava, you can see the superior vena cava formation, right and left brachiocephalic vein. So superior vena cava is opening into that, and at the level of the enters into the right atrium at third costal cartilage level. And then inferior vena cava enters into the right atrium at the seventh costal cartilage level. These two things you are supposed to write, and the right atrium you have to mark the junction between these two openings is called as sulcus terminalis. If you reflect, you can see that the thing present here, the sharp border is called as crista terminalis. This one is called as crista terminalis. And if you could see inside the smooth portion and the rough portion. The smooth portion and the rough portion. See, look at the rough portion. The rough part is formed by the primitive atrium, and the smooth portion is formed by the absorption of sinus venosus. You can see the smooth portion. This is the absorption of sinus venosus. Sinus venosus, which horn of sinus venosus? Right horn of the sinus venosus. Absorption of the right horn of the sinus venosus. Now if you open, you could see nicely, this is the smooth part. Smooth part, you could see the fossa ovalis. Fossa ovalis, you should write this margin crista terminalis. Fossa ovalis, you should write. Fossa ovalis is formed by the septum primum. The floor of the fossa ovalis is formed by the septum primum, and the rim, the margin, is formed by this called limbus fossa ovalis. It is formed by the septum secundum. And then opening, superior vena cava opening is seen and inferior vena cava opening is seen. Superior vena cava opening, at the entry of the superior vena cava, you have the SA node situated, or at the upper margin of the sulcus terminalis, the SA node situated. Both the way you can write. And then what is present inside is, you can see crista terminalis, sulcus fossa ovalis and limbus fossa ovalis. And if you could see in this area, this is called as triangle of Koch. This area is called as triangle of Koch. The boundaries I have already told you. You have to keep your finger like this. Okay, you have to keep your finger like this, and then you have to see the superior margin is tendon of Todaro, inferior margin is the septal cusp of tricuspid valve, and this outer border, this is the rim, this is called the base. The base is formed by the upper margin of the coronary sinus opening. So this is about 20 of Todaro. This is about the triangle of Koch. What is situated here is SA node, AV node. So SA node is situated at the entry of superior vena cava or at the upper margin of sulcus terminalis. SA node. AV node is situated in this area called as triangle of Koch. Triangle of Koch, the upper boundary is tendon of Todaro, and the inferior boundary of the septal cusp of tricuspid valve, which is placed inside. You could see clearly the septal cusp of tricuspid valve. What you are seeing inside is called the septal cusp of tricuspid valve. So tendon of Todaro, upper and inferiorly septal cusp of tricuspid valve, and this side you will be having the coronary sinus opening. This opening is called as coronary sinus opening. This is called as coronary sinus opening. Coronary sinus opening is guarded by Thebetian valve. So coronary sinus opening is guarded by Thebetian valve, and the IVC opening is guarded by Eustachian valve. These are the things you are supposed to write for the right atrium.